Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering bacterial meningitis. Now, before I even get started, I want to make this announcement. I already put up a post, but I'm going to keep reminding you guys that my live NCLEX review on priority and delegation that I was supposed to do on Saturday the 20th, because of my son's soccer schedule, I have to push it back to Sunday the 21st. So Sunday the 21st, 11 o'clock a.m. Eastern Standard Time, I will be on YouTube live going over the information. Don't forget, oh, I don't have a copy of the book, but I'll make another post, or you can go back to my original post for which book you will need for that review. Because of copyright purposes, I cannot share my screen on that book. So I encourage you to go out, get that book, go to your local library, or you can get it off Amazon. I think it's like 30, 35 bucks. So you can follow along, because I'm going to be going over specific questions, because the content found in those questions has been seen on NCLEX many, many, many times. And I want to make sure that you guys don't miss out on that. So I encourage you to do that. It'll be much easier to follow along if you have the questions in front of you, excuse me, instead of, watching me read the questions and trying to figure out what the answer is. I think it'll be better for you in that regards. But again, the live review on YouTube is going to be Sunday the 21st, 11 o'clock Eastern Standard Time, not Saturday. Okay, with that out of the way, don't forget, guys, please like this video, subscribe to the channel if you haven't done so already. You can also support my channel by sharing my content on your social media profile, with friends, co-worker, family, with your nursing instructor. Don't forget, I have audio lessons available for you on my website at nexusnursinginstitute.com. Without further ado, guys, let's get started. Look at what it says. So meningitis, by the way, I wrote this here. Bacterial meningitis has been seen so many times on NCLEX, HESI, and ATI. You need to know this. So let's talk about it. Meningitis, this is an acute inflammation of the meningeal tissue surrounding the brain and spinal cord. College students living in dormitories and individuals living in institutions such as prisons, they have a high risk for contracting meningitis. Let me stop right there. Really, guys, people, young adults, so the late adolescents, such as your 18s, your 19s, and your early adults, such as your 20, 21, 22, those are at risk. And people who are also at risk are people who live in close quarters, packed areas, such as dormitories, such as prisons, such as army barracks, okay? They're at high risk for contracting meningitis. Look at what this says. Untreated bacterial meningitis has a mortality rate near 100%. If it doesn't get treated, yeah, they're going to die. Okay, so it's very important to recognize those signs and symptoms, especially in somebody who's at risk, and get them tested and treated right away. Let's look at the clinical manifestations. Fever, not just any headache. Look at what kind of headache it says. Severe headache, nausea, vomiting, nuchal rigidity. That's that neck stiffness where it hurts. It hurts. They cannot flex the neck or extend that neck. Okay, they have neck stiffness. These are key signs of meningitis. Now, you put those signs together with them being a late adolescent, a late teenager, or an early adult, being around 17, 18, 19, 20, 21, 22. Around that age range, right? With them having these signs and symptoms, you better be suspecting bacterial meningitis. Photophobia, that's what's the word I'm looking for? Increased sensitivity to light. So they can't stand any light at all. Photophobia, decreased level of consciousness, and signs of increased intracranial pressure may be present. The headache becomes progressively worse and may be accompanied by vomiting and irritability. So this severe, not just a headache, it's a severe headache. It's progressive. That means as time goes on, it only gets worse. If the infecting organism is meningococcus, a skin rash is common. The petechiae may be seen on the trunk, lower extremities, and mucous membranes. Look at this test. A tumbler test can be done by pressing the base of a drinking glass against that rash. If that rash does not blanch or fade under pressure, it's positive. Okay. Complications of meningitis. The most common complication of bacterial meningitis is increased intracranial pressure. So all those signs and symptoms you see with increased intracranial pressure, including the decreased level of consciousness, decreased cognition, they're at risk for seizures. You better know your cranial nerves. And so that's what I wrote on the side, right? An easy way to know your cranial nerves, if you were to Google, in the Google box, put cranial nerves face numbers, cranial nerve face numbers, it'll show you a face and they'll show you the eyes. Eyes is 2, the nose is 1, the ears is an 8, right? It'll show you the face. That's a good way to remember those cranial nerves. The other one, oh my gosh, I taught this years ago. Let me see if I remember. On Old Olympus, towering tops, a Finnan German viewed some hops, to remember the first letter of each cranial nerve. I'll do a video on that because that's another video by itself. But make sure you know your cranial nerves. 1 second, guys. I forgot to put myself on focus. There we go. Okay. By the way, besides on Old Olympus towering tops, a Finn and German viewed some hops. If you guys have a different mnemonic or way to remember the cranial nerves, go ahead, put it in the comment section, because maybe someone can remember what you have instead of what I just mentioned. So put in the comment section. All right, diagnostic tests. And here I wrote culture before antibiotics. Before we even get into the diagnostic test, let me make this clear. When it comes to meningitis, the minute you suspect meningitis, so that patient comes in with the photophobia, the nuchal rigidity, the severe headache, the fever, it's an older adolescent or a young adult, they're in the dorm, they give you those signs and symptoms for you to know they're at risk for meningitis, and now you're seeing those signs and symptoms, right? The first thing you do is put that patient in isolation. You have to protect everyone else from that patient. 1 second, guys. Okay, so as I was saying, you're going to put that patient in isolation. After you have that patient in isolation, you've protected everyone from the patient. Then you're going to go ahead and get your cultures. And immediately after your cultures, you're going to give the patient antibiotics. We're not going to wait for the culture results to come back, because remember, it takes a couple of days for that culture to grow, for us to figure out what the patient's infected with, what they're going to be sensitive to. We don't have that kind of time, because remember, almost 100% of patients who go untreated, they die. So time is of the essence. So what we do after we get that culture, we put that patient on broad spectrum antibiotics. And once we figure out what that patient's sensitive to, what's actually growing, then the infectious disease doctor or nurse practitioner will prescribe something specifically for that patient. So that's important to keep in mind. So let's get into these diagnostic studies. When a patient has manifestations suggestive of bacterial meningitis, a blood culture and CT scan should be done. Diagnosis is usually verified by a lumbar puncture with analysis of the cerebral spinal fluid, because in that cerebral spinal fluid, if it's bacterial meningitis, they will see that bacteria that's growing, this is supposed to be sterile fluid, right? A lumbar puncture should be completed, look at this, guys, only after the CT scan has ruled out an obstruction of the foramen magnum in order to prevent a fluid shift resulting in herniation. That's important. So let's not miss that, guys. Let's go back to what it says. That lumbar puncture that's going to be done, we only do it after we've done a CT scan, and we make sure that there is no obstruction of that foramen magnum. Okay? We don't want herniation to take place. Specimens of the cerebrospinal fluid, sputum, nasopharyngeal secretions are taken for culture before the start of antibiotic therapy. Why? We don't want to mess with the results by giving the patient antibiotics first. So we're going to take the culture and immediately after give that patient antibiotics. A gram stain is done to detect bacteria. Interprofessional care. Bacterial meningitis is what? A medical emergency. Rapid diagnosis based on history and physical exam is crucial, as in muy importante, because the patient is usually in critical state when healthcare is sought. So you really have to know those risk factors and the signs and symptoms. So when you see it on a test question, immediately your brain goes to bacterial meningitis and you know what to do. When meningitis is, look at what it said, suspected, not confirmed, suspected. When meningitis is suspected, antibiotic therapy is begun after the collection of specimens for cultures, even before the diagnosis is confirmed. So we just suspected, 1, put them in isolation, 2, get that culture, 3, give them antibiotics in that order. Management, antibiotics, and they give you all the different antibiotics that the patient can be on. Besides antibiotics, dexamethasone, which is corticosteroid. Why? What do we give steroids for? To decrease inflammation. Nursing implementation. Prevention of respiratory tract infections through vaccination programs for pneumococcal pneumonia and influenza are important. Primary prevention measures, education and immunizations. Okay? Meningococcal vaccines are available that protect against all serogroups of meningococcal disease that are most commonly seen in the US, but they will not prevent all cases. Persons who have close contact with anyone who has bacterial meningitis should be given prophylactic antibiotics. The patient with bacterial meningitis is usually acutely ill. Remember, guys, if they don't get treated, they do what? They die. The fever is high. Head pain is severe. How many times have they told us severe headache? At least 3 times already. You're going to assess and record vital signs. You're going to assess their neurological status, including what? The cranial nerves. You're going to check the fluid intake and output, their skin, lung fields. You're going to check all of that at regular intervals. Codeine provides some pain relief without undue sedation for most patients. The head of the bed is going to be slightly elevated. I want you to remember, guys, when it comes to those neurological conditions, the lower that you have that head of the bed, the more you can increase that cranial pressure. So it's going to be slightly elevated. A darkened room and cool cloth over the eyes can relieve the discomfort of photophobia. You want to minimize environmental stimuli and prevent injury. Remember, this patient's also at risk for what? Seizures. So we're going to put them in a nice, quiet, dimly lit room. The use of touch in a soothing voice to give simple instructions or explanations of activities is helpful. Administer anti-seizure drugs such as your Dilantin or Keppra as ordered. Why? Because they're at risk for seizures. The fever must be vigorously treated. Acetaminophen or aspirin may be used to reduce fever. We can give them a cooling blanket because remember, we're trying to cool them down. That fever can be high. Take care not to reduce the temperature too rapidly because shivering can result causing a rebound effect and increasing that patient's temperature. So if you bring that patient's temperature down too quickly, they'll start to shiver, and that within itself will cause that rebound effect and make the temperature go even higher. Again, cooling blanket to bring down that temp. Assess or to help bring down a temp. Assess the patient for dehydration and adequacy of fluid intake. We want to make sure they're still getting enough fluids. That's why you're doing that I&O. Meningitis generally requires respiratory isolation until the cultures are negative. Meningococcal meningitis is highly contagious. And that's why we don't wait until that patient has been confirmed with meningitis. The minute we suspect meningitis, we're putting that patient in isolation. They're going to be in respiratory isolation until the tests have come back negative. In this period, stress the importance of adequate nutrition with an emphasis on high protein. Protein's important for what? Healing. High calorie. Calorie gives you what? Energy to do what? Fight off infection. Okay. So high protein, high calorie diet in small, frequent feedings. Why small, frequent feedings? Number one, they're going to be exhausted. That's number one. And number two, we give small, frequent feedings to decrease the GI complications that can occur. Okay. So during recovery, they're getting high protein, high calorie diet in small, frequent feedings. You're going to make sure that the patient gets enough rest and sleep. One more thing I want to cover with you guys. Take a look at this table into professional care for bacterial meningitis. Remember, we're going to be doing a lumbar puncture. We're going to be analyzing that cerebrospinal fluid. We're going to be doing blood cultures. For management, patient needs lots of rest. We're going to give IV fluids. We want to make sure that they don't get dehydrated. We want to flush that system. We want to hypothermia. We're going to be watching out for the high fever, but we got to make sure that we don't cause the opposite, and we don't want to drop that temperature too quickly. Drug therapy, IV antibiotics, and they give you a list of antibiotics we expect this patient to be on. Codeine for the headache, dexamethasone to decrease that inflammation, acetaminophen or aspirin for the temperature of 100.4 or higher. Dilantin for the seizures or to prevent the seizures. Mannitol for what? That increase intracranial pressure. So we're giving mannitol to promote diuresis to decrease that pressure in the brain. And guys, that is your bacterial meningitis in a nutshell. Please let me know what you thought about this video in the comment section. Let me know if you have a trick that you learned about how to learn the cranial nerves. Go ahead, put that in the comment section as well. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. Again, my live YouTube session that I'm going to be doing on priority and delegation. By the way, guys, this live is going to be beneficial for both the RN and the LPN, because I'm going to be covering the differences, and if something is different for the RN than the LPN, I'm definitely going to point that out. So it's going to benefit you both, whether you're studying for RN or LPN. Sunday the 21st, 11 a.m. Eastern Standard Time. And don't forget, during the week, you can catch me covering a variety of questions on my social media platforms such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.